and we'll begin now. My name is David Reiner. I'm a science officer with the California Initiative to Advance Precision Medicine, and I'm joined by my colleague, Dr. Elise Pennington, and Director of Precision Medicine, Dr. Julianne McCall. We're really excited to give you this webinar today about our depression research request for proposals. Next slide, please. So this is an overview of our presentation today, which will take around 20 to 25 minutes as an estimate, and followed by a Q&A where you can ask any questions that are relevant that you like, and that Q&A portion will not be recorded. So we'll stop the recording at the end of the presentation portion. So on the next slide, we'll go over a background on the California Initiative to Advance Precision Medicine. And then we'll go over an introduction of the depression research program, timeline of the request for proposals, eligibility, selection process stages, review and selection, and then the Q&A that I mentioned. Next slide, please. So our office defines precision medicine as the right medication for the right person at the right time. We were established in 2015 and have a $67 million investment from the state so far. We specialize in grant making for demonstration research projects that feature cross-sector partnerships, reduce health disparities, and really highlight and emphasize community researcher collaborations. Next slide, please. And these cross-sector partnerships between researchers, communities, healthcare providers, industry, and others are really to kind of ensure that research results are aligned with the priority of California communities, and that the dollars invested in research by the state are, there's a return on that investment with improved health in communities. So we have a portfolio, research grant portfolio that you see here. We have several completed projects spanning a variety of health and disease states and topics. We have two current portfolios, one on cancer disparities and another on adverse childhood experiences. And we're here to talk to you today about our upcoming and current depression research funding opportunity. Next slide, please. So we'll give you an introduction of this depression research program. We have $9 million in research funds to improve strategies for prevention, diagnosis, and treatment of depression. And this funding is really targeted for mental health care for individuals and not a one-size-fits-all treatment for the average patient. So 3 to 5 demonstration projects will be funded at $1.8 to $3 million each. And the goal is to better understand depression in underserved communities. And as I mentioned, with the community partnerships, nonprofit academic research institutions are required to partner with community-based organizations. Next slide, please. So we'll give you an overview of the timeline for the request for proposals, or RFP, on the next slide. So we released the funding, the notice of funding intent in January of this year. And this summer, we've been busy collecting perspectives on community needs for depression and mental health with a request for information and listening sessions that we held throughout the state. And now, as of September 22nd, we released the request for proposals. And there's a 3-step process for this request. The first are letters of intent that are due October 30th of this year. And then concept proposals are due December 1st. There'll be a down selection of concept proposals to final announcement of finalists in January of next year. And the finalists will be asked to submit full proposals in February, and we'll announce awardees in March of next year. And we'll go over this process in more detail during the course of this presentation. Next slide, please. So we wanted to give you just a brief overview of the request for information and listening sessions that we held. And we held these to ensure that the RFP was responsive to community needs. We had the RFI open online from July 17th to August 18th of this year. And we held 5 listening sessions throughout California. The feedback from these listening sessions and RFI was incorporated into the RFP via community partnership requirements and example projects or aspects of projects. On the next slide. So next we'll go over eligibility. And on the next slide, the lead principal investigator must be affiliated with a California nonprofit academic research institution, including tribal institutions. Demonstration projects must take place in California. Only one proposal per team will be accepted. An individual may serve as lead PI for only one proposal, but may contribute to multiple proposals as a member of the project team. On the next slide. Current and former CIAPM lead PIs are ineligible to act as lead PIs, but may serve other roles within the project team. Team members who are not current or former lead PIs, but have served other roles on a CIAPM funded project are eligible to apply as a lead PI. There will be no more than one award per primary institution, but several lead PIs may apply from the same primary institution. And I know that was a lot of on eligibility, so I just wanted to add that if you do have any questions on eligibility, specific questions, feel free to reach out to one of us, and we'll have our email addresses at the end of the presentation. So with that, I'll pass it off to Elise to go over the next portion of the presentation.
Yeah, thanks, David. Thanks, everyone, for being here. So next, we'll talk about the stages of the selection process. So as David mentioned, there's 3 stages with 3 different due dates listed here, and we'll go over each one individually. But what you see in this screenshot here is the submission portal. So when you go to submit your application, this is the page that you should see for all 3 stages. And we'll use this portal for communicating with you as well as reviewing applications. And so next, we'll go over the first stage, which is the letter of intent, which is due on October 30th of this year by noon. And so the letters of intent are required, but they are non-binding and they're not scored. So this is to give us a sense of the general theme of your project, but you are able to modify the details between the submission of the LOI and the submission of the concept proposal. And so the letter of intent can be 1 page long and must include these categories. So we're requiring a tentative proposal title, the name of the primary academic institution, and the name, title, and contact details of the lead PI. And then we'd also like the tentative project description. As David mentioned, our projects require a community partnership. So one of the PIs on the project must be a community partner. But we understand that these relationships take time to develop. So that community partnership is not fully required until the concept proposal. But we do encourage you to start forming those connections, or if you already have those connections, to include them in the letter of intent so that we can see what to expect. So the second stage of the RFP is the concept proposal. And these are due on December 1st of this year by noon. But the instructions for the concept proposals are already provided in the RFP document. So feel free to start on those as soon as possible after you submit the LOI. And the concept proposal requires 3 separate documents. So the longest part is a 3-page concept proposal, which we'll go over a bit in the next slide. It also requires a 1-page AIM development process. So this basically asks you to describe which PIs, which partners help develop each of the categories within the concept proposal, because we want to make sure that the community partners are engaged in developing this process. And we want to see how the academic researchers came up with their ideas. And then the third required document are the biographical sketches. These are for the scientific partners and will be in NIH format. And then for non-scientific partners, we ask for resumes. And that third document can be any length, but there's more requirements listed in the RFP. So for the 3-page concept proposal, we'd like to see these 10 categories. So I'll just read through these quickly. We'd like you to describe the impact on health outcomes and equity, the project plan, data, ownership and sharing, precision medicine assets, participant and community engagement, impact for patients and participants, approaches for improving training and education, anticipated challenges and proposed solutions, project team, and budget overview. And each of these is described more in the RFP, and we're happy to answer any questions that you have about them as well. So finally, the third stage is the full proposal, and this is for invited finalists, which I'll describe a bit. So the full proposal will be due on February 15th of 2024 by noon. And so once we receive all of the concept proposals, they will be passed on to our expert selection committee, which I'll go over in a few slides, and they will select a subset of those concept proposals to advance to the full proposal stage. And we will be announcing who advances to that stage in January of 2024. And the current RFP does not include instructions for those full proposals, so we'll also be providing instructions at the time that we announce who those finalists are. So before the Q&A section, we also want to discuss the review and selection process. So as I mentioned, we'll have an expert selection committee, and they will determine the finalists who move on from the concept proposal to the full proposal stage, and they will select the awardees from the full proposal stage. So the expert selection committee will be composed of 11 to 15 subject matter experts spanning depression, mental health, community engagement, and more. And these will be out-of-state experts, so they are ineligible to apply to reduce conflicts of interest. The selection criteria are outlined in the RFP. If you'd like to see what we will be, or what the selection committee will be reviewing based on. And then after the full proposals are submitted, final awardees will be announced in March of next year, and we anticipate that the projects will start in June of next year. And so now that we've given a brief overview of everything, we want to open it up for a Q&A session. And we just want to thank you again for being here and for expressing interest in this program. We've listed some email addresses that I'll leave up on the screen for just a few more minutes. So David is the main point of contact for this project, or you can reach out to our general email address, and everything can be found in detail on the website that has been posted in the chat. So feel free to post your questions in the Q&A or chat, and we'll answer them live here. And we'll stop recording now as well.